Dr. Sean from Gallagher Performance coming at you today with a discussion of a topic that's pretty trendy within physical medicine and also in rehab, as well as performance training and even the fitness industry, and that's the identification of weak glutes. And the reality is, most of us that are working with the general population are not truly finding weak glutes. What you are finding are inhibited glutes. And there's a big difference between weakness and inhibition. Weakness is a true clinical finding, either from a traumatic injury or a neuromuscular condition where the nerve supply to a muscle has been compromised to a degree or completely disrupted, and now the ability to contract that muscle has been diminished or is non-existent. That would be considered true muscular weakness. So if you have gone to a physical therapist, or be it a chiropractor or even your personal trainer, and if they're telling you you have weak glutes, you might want to reconsider what it is that they're trying to explain to you, because chances are you don't have true glute weakness. Now, I want to illustrate this point with a case of one of our athletes who, as a football player and a collegiate football player, who anyone will look at him is strong built. He's got a backside that's built like a bowling ball and can squat over 400 pounds, can lunge and do step ups with significant amount of weight. And he's sprinting and jumping and performing sport specific maneuvers on a regular basis, all which are going to hit your posterior chain, being the hamstrings and glutes and low back. It's pretty hard to have glute weakness when you are regular training your posterior chain. Now, he developed knee pain. A therapist told him that he had glute weakness and that therefore they needed to do some step ups, some other drills, more so in a body weight fashion, to get his glutes re-strengthened. I had a hard time with this because I can tell you I would disagree with the fact and the notion that this kid has a weakness in his glute that needed to be addressed. What he truly had was an inhibition of his glute. When I followed up with him after he got back from school, what we found was an SI joint dysfunction, and that SI joint dysfunction was disrupting the nerve supply, if you will, the communication to his glutes, not allowing them to fire as appropriately as they should. Through chiropractic manipulative therapy or adjusting, we are able to see improved hip extension and glute firing just from that alone. Now, that is one case of joint dysfunction inhibiting muscular function. A lot of times what we see is sometimes postural or muscular imbalance is playing into it too. This is a drawing of what is known as lower cross syndrome, something that was identified by Yonda. This here, the green arrow or green line, indicates areas that typically get tight or prone to more tightness in the body, such as our hip flexors, our rectus femoris, part of our quad, and the psoas, as well as the low back, be it the erectors and the QL of the low back. These can get tight, and when a muscle gets tight in the human body, typically the antagonistic muscle, or a muscle that opposes that said tight muscle, then tends to get inhibited and can display, quote, weakness, because now it's not going to fire appropriately. It's not going to have the same lengthening and shortening abilities as it once had because of this reciprocal inhibition that occurs within the human body. So in this case, it becomes the glutes and the abdominals that typically display this weakness that is more of an inhibition. To get around this, we can go from a manual standpoint, and this is why some people advocate whether it's foam rolling or stretching or mobility drills to attack the hip flexors in the low back. However, that's just one piece of the puzzle. Not saying those things are bad, but typically if someone's just stretching, foam rolling, they're not really getting at the true underlying problem. Typically what they need to focus on is improving their technique, making postural considerations, simply maybe not sitting as much, or from a manual standpoint, they can look at chiropractic interventions that address joint dysfunction that may also be inhibiting muscular function. So if we were to circle back here and talk about coaching and cueing, a lot of times, especially in fitness programs and in athletic performance programs, you do see the staples of squat and deadlift variations, lunge variations, step ups, hyperextensions, glute ham raises, good mornings, all exercises that will help to target and develop the posterior chain, and in this case, the glutes. However, if that individual is not being coached or cued properly about how to utilize the glutes during that movement, or if you go down the chain even to the foot and ankle, and if there's something off with the foot and ankle and how that feeds in incorrect firing patterns up the chain into the hip, then ultimately the glutes are going to remain inhibited. They're going to remain weak, and all your failed attempts to stretch and mobilize and foam roll aren't really going to get you much of anywhere. This is why we're such a big fan of proprioceptively demanding exercises, coaching and cueing proper motor control patterns, because that will do more for the human body than any amount of stretching, foam rolling, and mobility drills will ever do. Most don't have appropriate motor control as it is, and then you throw more mobility and more motion at them, and typically it becomes Pandora's box, because then you can just open up a whole lot of unknowns in terms of how they're going to respond, and typically most people don't respond to having more motion or becoming hypermobile. The muscles are going to become tighter, they're going to splint up, they're going to try to protect and guard against excessive amounts of joint motion or uncontrolled motion in a certain area of the body. So, to recap here, one of the things that we talked about, again, distinguishing between weakness and inhibition of the glutes. Couple things to consider to fight your glutes getting inhibited, not weak, but this is why chiropractic care and manual therapy can be a regular staple in anyone's fitness or athletic program to keep the body functioning optimally, the joints functioning optimally, and you're going to get better neuromuscular firing, which is going to enable you to display that within your exercise programs. Then, within the exercise program, you want proper coaching and cueing, and that's going to involve not just the hips and the glutes and how to brace and use your abdominals, all good things, all that need to be there, but it also has to begin with the foot and the ankle and making sure the joints are centrated through the entire chain. And when I say centrated, optimal alignment to allow for optimal muscular function. That said, those two things there between coaching, cueing, manual therapy, and then simply getting up and moving. Don't be as sedentary as many of us tend to be. You can exercise hours a day, but if you're still on your can and laying in bed for the majority of the day, which that ends up happening to a lot of us, that can ultimately put your glutes to sleep, or kind of help them become inhibited, feed into hip flexor tightness, even low back tightness as well. You want to be up, you want to be moving, and you want to be doing that a good chunk of the day. All right, 8 hours plus a day would be great to shoot for. That might not be realistic for many of us, but the point remains, the more you're up, the more you're moving, the harder it is for your glutes to become inhibited and for them to become problematic. So, hope this was a helpful video. Any questions, comments, please leave them below. And we look forward to providing you with more educational videos to come. Thanks for listening.